There really is no procedure in cardiology that we don't do here. We are always trying to strive for the newest technology, the newest care we can give to our patients.
I would say we are rigorous in our sort of pursuit towards clinical excellence, and I'd even go so far to say, perfection, because, it's someone's mum or dad or grandma. You want to be assured that your loved one's getting the best care possible.
More recently, we've expanded our area to include left atrial appendage occlusion, which is essentially a procedure where you insert a device into the left atrium of the heart to wall off an area of the heart where blood clots form. We've done this in collaboration with our structural heart doctors, our advanced imaging doctors, and have brought that technology here to Grand Rapids.
So one of the things that's most important to me is the research that I do. We're always striving to do everything we can to provide the latest and best care for patients. I do research in two different ways. First is I do basic science research with scientists at Van Andel, attempting to find new, better therapies for patients so that one day they may not need surgery. But also we do a lot of clinical trials for patients, providing care for patients that would not be able to get any care at all if it weren't for the ability of us to do and enroll them in clinical trials.
Patients who have lived with chest pain for years and years suddenly can be relieved. And when you do take someone that's so sick and you help them, they're so appreciative. That's what gets you out of bed in the morning, and that makes you want to keep coming back for things like that.
Education's always been a big part for me, even from the start of my practice. And being one of the more senior people right now, it's been a big part all the way along. But to think that I could work with a medical school across the street, that I can walk through a tunnel to go over there, to see the Children's Hospital, to see the Meijer Heart Center, it's a dream, absolute dream. I get fired up every day.
Exciting to me is that we are right now in the process of forging a partnership with the Department of Psychiatry and Psychology. One of the biggest factors that impacts patients' health, not just their cardiovascular health, but their overall health, is their mental well-being. And somebody who's been chugging along their whole life, who feels well, who all of a sudden has that first heart attack or that big event, an often unrecognized problem after that event is depression associated with it.
When it's the heart, when the clock is ticking, you need immediate answers and a team of experts prepared for any heart and vascular condition. You need life-saving care, treatment you can't find anywhere else in Michigan, and a clear path to recovery. You need Spectrum Health, recognized among the top 5% in the nation for overall cardiac services. When the unexpected happens, expect extraordinary. Spectrum Health Heart and Vascular Care. Expertise doesn't happen overnight. It takes skill, experience, and a drive to be the best. Because the more you do something, the better you get. At Spectrum Health, our experts perform more advanced life-saving heart and vascular procedures than any other hospital in Michigan. And the results are extraordinary. We are among the top 5% in the nation for overall cardiac services. When it comes to the heart, expect extraordinary. Spectrum Health Heart and Vascular Care. Expertise doesn't happen overnight. It takes skill, experience, and a drive to be the best. Because the more you do something, the better you get. At Spectrum Health, our experts perform more advanced life-saving heart and vascular procedures than any other hospital in Michigan. And the results are extraordinary. We are among the top 5% in the nation for overall cardiac services. When it comes to the heart, expect extraordinary. Spectrum Health Heart and Vascular Care.